Hey, it's Abby from Turn Sounds. Just a reminder to refresh your first aid course annually.
Hi, I'm Shelby. I'm a clinical exercise physiologist.
And I'm Abby, a clinical nutritionist. And this is the Move Your Mind podcast,
where we talk all things diet, exercise and well-being and back it up with evidence
from our Bachelor of Health Science degrees. So welcome and let's get into it.
Hello, Abby.
Hello, Shelby. Episode
35.
Ooh.
I know, we're getting up there.
We are.
Getting up there. And today we're going to talk about whether you should exercise when you're tired.
Simple.
I feel like we're recording later in the evening. We said, hi, how you doing? And then we're both like, oh, so tired today. And we both have different factors influencing that. But you actually did really well with how you managed your day.
Yes.
So that's very good. I'm proud of you.
Yes, I was going to go to the gym and then just my mental space was just not ready to put lots of focus into a intense exercise session. So I chose to go for a walk, get some vitamin D, nature to relieve some stress.
Sounds really good.
And I didn't overdo it.
Can I just get you to move your pop filter down, please? It's covering too much of your pretty face. Our viewers watching can't see you. There she goes. Cool. And yeah, that's pretty much our podcast. Done. Thanks for listening, guys.
No, there's more
Low
to
intensity
it,
when you're done. So fatigue is actually a really, really common health symptom. Lots of people feel fatigued, which is pretty much just feeling tired, feeling lethargic. But yeah, even though it's really, really common, and while it can be associated with a more serious medical condition, it's a lot of the time not. We're just tired.
Yeah, I feel like it's kind of like the situation where if you feel anxious, it doesn't necessarily mean you have anxiety. It's kind of like if you feel fatigued and tired, it doesn't necessarily mean you have chronic fatigue.
No.
Some individuals, yes, but it's kind of a more biochemical thing.
Oh, yeah, and we're actually going to go into chronic fatigue syndrome in the later half of the podcast. Yeah. But yeah, pretty much it can be any kind of combination: poor sleep, too much work, too much stress, poor diet, and then inadequate exercise. So if you're not active enough, it can actually make you more tired. Which,
But if you're too active, that can also make you
we've
more
already covered that. So overtraining is a separate issue that I'm not going to touch on. What I'm talking about today is if you are relatively inactive and feeling tired. Okay. It's kind of the population I'm talking about today, where there absolutely is room for more exercise.
Like they're kind of lacking motivation, kind of feeds in that kind of cycle, feeling crappy and then not doing anything to make you feel better, feeling more crappy.
Exactly, yeah. And so while it does seem counterintuitive to exercise when you're tired, it's probably one of the best things you can do. And I remember even we touched on it in one of our first ones on mental health. The whole idea of just like jump up and do 5-star jumps, and you can get that kind of boost of hormones.
Chemicals, endorphins.
Yeah, exactly. Yeah, that make you feel a bit better, really short term.
And I remember from that episode saying how exercise actually increases the size of your frontal lobe or your hippocampus.
Hippocampus, yeah.
Which can then increase neural connections for like things like serotonin production.
Absolutely.
I remember that.
Absolutely.
I loved that.
I remember that blew your mind.
It was
amazing.
so good.
Anyway, so today we're probably looking a little bit more at like chronic central nervous system and modifying that, or like modulating maybe is a better word to say. And then aerobic fitness will absolutely have something to do with it as well. Because if we're thinking, like you just said, you're tired, you don't want to do anything, which means you won't do anything, which means you get deconditioned. And so you're just not able to do what you could do physically.
Don't use it, you'll lose it.
Absolutely. So kind of really small bouts of exercise, I feel, can have a pretty good effect on energy. Obviously, after a workout, you might feel a bit tired.
Yes.
But then long-term consistent exercise is a really nice way to overall get more energy.
Because you're building that tolerance and you're building your body's ability to resist stress and adapt to certain stresses.
Absolutely.
We've talked about that too,
Absolutely, yeah. So when I first started looking, one of the first recommendations in studies and just like in general is to start with aerobic exercise. So walking, something.
Aerobic means oxygen.
Absolutely, yep. So I kind of got me into train of thought. I was like, well, is it predominantly the aerobic, is it the lack of aerobic fitness that is the driver in this kind of issue.
What came first, the chicken or the egg?
Yeah, exactly. You won't necessarily improve fatigue by improving aerobic capacity to begin with. There are other changes that occur. Does that make sense?
Okay, so even though it's aerobic fitness, the increase in aerobic capacity is not the main driver?
Yeah, well, my first thought was, is it just aerobic fitness?
Yes.
Like, is that the issue?
But there's
no,
obviously other biochemical processes that go on.
Correct. And like you said, just our ability to deal with stress and whatever, like how full is our cup? Is it just overflowing, or what can we do from our stress tolerance point of view?
Okay.
Have I made that comparison before with the cup?
No.
Oh, amazing. So everything in your life fills your cup. You have a cup.
Yep.
And different bits. Stress makes it go up. Work makes it go up. Poor diet fills it up more. Poor exercise fills it up more. And then once we start to have these breakdowns, when we have pain, when we have poor, what did we just talk about? Absorption of food, all of these things. So that's when our cup is overflowing and we can't manage it anymore. So we have two options. We can either decrease what's in the cup or build a bigger cup.
I like that.
Yeah, it's not mine. I think his name's Greg Lehman. He's amazing. Anyway, so yes, you can either get more sleep, eat better, exercise more, which we'll do both. The first two will lessen what's in the cup, and by exercising better coping strategies, we can make the cup bigger.
I love that.
I know.
Yes.
So all the issues come when our cup is too full.
Yeah.
And then you've got two ways to deal with it. Anyway, sorry, this is...
No, that's really cool. I'm just pondering.
Cool, I know. It's brilliant, isn't it?
Yeah.
I use it to explain chronic pain a lot.
Yeah.
It really is good.
Yes.
It's a nice way to encompass
It's very holistic.
Yes, exactly.
Which is what we're about.
Yeah.
Like, not just micro-focusing on one aspect, assessing your whole life.
Absolutely. So, yeah, what's filling your cup? Anyway, so what I was getting with...
Yeah. I'm just saying, because usually when you say, fill your cup,
I know,
it's usually good things. And when you just said, what is filling your cup? I was like, what do you mean? You're just talking about stress. But that's switching it around.
Yeah, exactly.
It's the stress
we don't want
cup.
an overflowing cup. Yeah. Your
Not
cup
that
can be
cup.
full because we want fulfilled lives, but you don't want it overflowing.
Yes. When your kind of the demand around you doesn't meet capabilities, that's when you get the overwhelm and the stress.
Absolutely.
Yeah.
That's where all the negative things come. Yeah. My initial point was to bring up the study that I was looking at. So we had so everyone here complained of fatigue, but didn't have any medical conditions. So weren't necessarily diagnosed with chronic fatigue syndrome. They were just generally tired in their day and inactive. Based on a questionnaire and comparison to guidelines.
Okay.
So then what they did was they had the control group who did everything the same. They didn't change anything. They had a low intensity group, which was pretty much like a leisurely walk, and a moderate intensity group, which was more akin to walking uphill.
And that was once a day?
So 20 minutes, 3 times a week for 6 weeks.
That's all?
Yes, that's all.
Wow.
Both exercise groups had a 20% increase in energy levels by the end of the study compared to the control. But the more intense group didn't necessarily do better. So the lower intensity group reported a 65% drop in feelings of fatigue compared to a 49% drop in the group doing the more intense exercise.
Yeah.
So here is where your low intensity exercise really comes in handy. Your system is already stressed because you're feeling tired. So you want to limit
the additional stress, because we've discussed this too. High intensity exercise can maybe even fill your cup up even more.
Correct. Yeah. So it's a Goldilocks situation of not too much, not too little, just right.
Yes.
And so that low intensity walk, and you wouldn't be able to single this out to just the exercise benefits. Like if they were walking outside, if it was a leisurely pace, like you can't discount all the other benefits that would have for relaxation and mindfulness and everything as well. But higher intensity is definitely not always better. And so that was, wrecked my mic. So that was shown in this really cool study, and that was 20 minutes 3 times a week, which is really easy to put in.
And that's a really important thing to realize, I think, too, because sometimes when you're in that rut, then you think you have to do something extravagant to get out of it. And I feel like that puts up another barrier for people because they feel like they can't do what they, in quotations, need to do to get better. Exactly. All you need to do is walk
20 minutes. 20-minute easy walk 3 times a week.
And then, like, you know, surely that has follow-on behaviours.
Yeah, exactly. Well, then you'll start feeling more energetic. So more than likely you could push that out to half an hour. More than likely you can add a resistance training session in during the week. More than likely you can add whatever you like.
When you realise that exercise is not the enemy and won't drain you.
Exactly.
Because it will actually make you feel better.
Yeah, you'll probably even finish your walk feeling refreshed. Yeah. So then you can time it better. Do you need to put your walk in the morning before work? Or do you need it at night so that you have enough energy to make dinner? Like all these things, you can really then utilise the benefits. Both short-term and long-term.
That's something that I'm actually implementing in my life at the moment.
Yeah.
I find, like, because there's a lot going on, as we discussed at the start. We're both a little bit all over the shop, a little bit tired.
Yeah.
And it's easy for me, you know, some days, I think even last week, I was getting out of bed and being like, oh, I'm tired. So I'd just sit and start my work. And then I'd kind of go on that slippery slope and be like, oh, maybe I'll go for a walk in the afternoon. I'd get tighter and tighter and tighter. So now when I get up, I open my blinds, I have a nice glass of water, I kind of plan out what I want to do for the day, and I go for a walk. I get it done to set myself up, kind of boost the energy, feel accomplished. It's kind of like that psychology type of thing. Like, I've done something good for myself today, so I'm going to continue that pattern.
Absolutely.
And keep pushing
and again,
through.
following through with those behaviours. Yeah. And then, so I've had a different kind of response. I have some kind of unmodifiable things at the moment that are increasing my stress, my physiological stress levels.
Yeah.
And so what I've done is cut down from 4 resistance training to 2 resistance training a week.
Yeah.
Because I've just gone, look, I need to stay relevant with what my body's going through and how I'm feeling, and I have to stay on top of this. So yeah, cut down from 4 to 2, and it already feels way less overwhelming.
Yeah.
And way more,
and
manageable.
it's
for now at least.
Relative, isn't it?
Correct.
In terms of the tiredness, some people like you that train quite a bit, then that's when you reduce it to feel better. But then people that are in that starting in that lower, that's when
really
increasing
good point.
it.
Yeah, absolutely. Yeah. So yeah, I'm not even in the population that I'm talking about right now. Absolutely.
Because if you're feeling tired and you increased, then that would be
like, ditto with
Shelby.
you. Yeah, ditto with you. So we're both, neither of us all into this. But
we're type A.
Just I wanted to say was to highlight the 2 different differences in strategies there.
Yeah.
But what that study did find, and so this is really what made me consider, well, what actually is going on, is this is what they said. Findings suggest exercise acts directly on the central nervous system to increase energy and reduce fatigue. Notably, the improvements in energy and fatigue were not related to increases in aerobic fitness. So it's not necessarily getting aerobic fitness up, but it's, again, modulating your nervous system response to energy and feelings of fatigue.
So that once again comes back to the benefits of exercise beyond just fitness.
Yeah. And the reason it impacts your central nervous system is because of the hormone release, epinephrine, norepinephrine. So in small amounts released by exercise, these will actually be energizing for you.
Yes.
They are the stress hormones, but in small amounts, they're really nice for you.
Yeah. And you've also got to think in terms of oxygen. I know the study said
I was just about to say, yes.
Yeah, like increased uptake of oxygen, increased energy supply to the brain.
Yeah. And that would have been because that study was only 6 weeks, so not necessarily long enough to influence aerobic fitness. But absolutely, you keep doing that, your aerobic fitness will get better, your cardiovascular system will get more efficient, your VO2 max, so how much oxygen you're able to consume, will go up.
Yep.
You'll improve the circulation of your oxygen because your muscles will get bigger and better at moving things around. And absolutely.
That can even filter through to things like improving your energy through improving sleep quality.
I was just about to say, absolutely. You'll be tired from your workout.
I just need to be quiet, hey?
Yeah, it's good. We're on the same.
On the same wavelength.
So, yeah, more than likely you'll improve sleep duration and quality by exercising.
Yeah.
Because if you've ever had just like a lazy day and like you feel, but then you can't even sleep at night because it feels, like you haven't done enough during the day to then be able to sleep.
Yes.
That's horrible.
I've certainly had a few of those days in my time.
Horrible.
And sometimes, just that walk. That's on days I'm feeling like that, I set myself a goal. I was like, get outside and walk.
Yeah.
And if I start walking and it's 20 minutes, fine. I did it, but it's most times I get into the groove. I'm like, oh my gosh, this feels so good.
The hardest thing is just to start. So even if you just go, okay, a 2-minute walk, just get out.
Yeah.
Then more than likely you'll stay out for longer.
Yeah. Or just get around your block.
Yeah. Put my
15.
shoes on.
Yeah.
Yeah. Just get past that first. Get off the sofa. Close your phone. Whatever it is. Just get the first thing done and the rest rolls.
Yeah. Even just walking along the beach.
Nice.
If you have a dog, take the dog beach.
That was, I think I've mentioned this before. That was always a running joke in uni. Like, how do we get our clients to exercise more? Do they have a dog? Take their dog for a walk.
Yep.
Always was our first answer.
Because it makes you happy because you're making them happy.
Doesn't hugging your dog release like oxytocin and stuff? Happy hormones?
Well, I would have a lot of oxytocin.
It's full of it.
I love giving my dog some cuddles.
So we've talked about kind of general population in where nothing really is going wrong. They're just kind of tired, probably deconditioned. But there also is something called chronic fatigue syndrome.
Yeah.
Or myalgic encephalomyelitis.
Okay. Say that again.
Myalgic encephalomyelitis.
Myalgic. So that's nervous.
Yes.
But also myo. So like
Maya.
Yeah.
Oh,
Maya.
Yeah.
Myalgic.
Yeah.
And then encephalo.
Yeah.
It's brain.
Yes. Myle is like the meninges, I think. Is that what you're referring
So
to?
all the kind of like layers of your brain where all the nerves are.
And then the itis is a form of inflammation.
Yeah.
So, yeah, like a muscular neural inflammation type thing. They don't actually know that it's not really that. It's just like they say, they shorten that to ME/CFS. They kind of combine those two things together. But chronic fatigue syndrome, like they're always slashed together.
Yeah, because I also hear like things like adrenal fatigue.
Yeah.
Not that that's actually a true thing.
Yeah.
It's but yeah, there's lots of terms that kind of go together to make that chronic fatigue syndrome.
Yeah, and that's this. Yeah, exactly. That's it. It seems to be way more. So it's a feeling of like always being tired, like always being tired, more so than usual for I think it's 6 months. It's kind of a diagnosis by elimination in the fact that nothing else is going on.
Yeah.
So they will then end up saying chronic fatigue syndrome.
Yeah.
Tends to happen more in women than men. Like quite a bit more, 70 or like 3/4 will be women. But something that's coming up recently, especially in mental health research, is that men are just less likely to report the symptoms. So it's not necessarily occurs more in women. It's just we get more reports of it in women because they tell their GP or they tell someone.
Yeah, I was reading something today
leads to a diagnosis. Yeah, so that's massive in mental health research because the numbers, like for depression, are way higher in women, but suicide are way higher in men. So it's like, well, that's a disconnect. It's because men don't typically talk about it.
And that's a bit of a movement, though, isn't it?
Yeah,
like
absolutely.
men speaking out about their mental health, which is amazing.
Absolutely. We could do a whole thing on it.
Yeah.
So chronic fatigue syndrome, also often linked with fibromyalgia. Have you heard of that?
Yes, I have. I saw a client, fibromyalgia.
I am intrigued. I like this client base. But that's kind of a chronic widespread pain. But same thing, very tired, usually quite deconditioned. Chicken or the egg, did you stop moving and you got tired? Did something else cause? So that's something with chronic fatigue syndrome. It usually has a trigger. Same with fibro.
Yes.
In that it's like a viral infection or trauma or something's happened and then you just kind of don't pick up. So that's kind of your answer there. You've had something really stressful, really tiring on the system happen and you haven't been able to pick back up.
Yeah, it's kind of like the cup thing again, but think about the cup as being kind of like immune response. If you've got lots of triggers, and then you have like an event. A lot of the research that I've done is Epstein-Barr virus, glandular fever, kind of being the trigger for the chronic fatigue syndrome
absolutely.
onset.
Yeah.
You see that a lot.
That would be big. Yeah, absolutely. And then you get really tired in like ways that us normal people just couldn't comprehend. And then that leads to you not doing much. It can impact your ability to work, thinking, depression, anxiety, irritability, grief. It just kind of snowballs if it's not managed early enough. So absolutely can be pretty hectic, can last ages.
Yeah, because you think if it's like the inflammation of the brain, like you think of all the neurotransmitters as well, like how are they going to perform their function if your brain's kind of resistant? You kind of think of it as hostile a little bit.
Yeah. I don't want us to get too caught up in the inflammation of the brain thing, because it's not necessarily...
But even systemic inflammation, that usually comes with chronic fatigue syndrome and fibromyalgia, which is probably why they're linked.
Exactly. Yeah, exactly. Exactly. And so also with chronic fatigue syndrome, you'll get way more tired after activity than normal. Towards the end of the day, it's probably worse because you've had to do something during the day. So, this kind of, not quite lined up response to the activity you're doing, and you'll just get wiped out maybe for days. So it can be quite intense, the reaction. There's a whole list of kind of like different symptoms and stuff, so I don't want anyone diagnosing themselves. Could be a pretty long process to get to this. But if you're feeling these kinds of ways, then absolutely. So then we're talking, which kind of makes sense, impaired memory and concentration, sore throats, which is kind of what you're talking about, tender lymph nodes, muscle pain, joint pain, headaches, non-restorative sleep, and extreme fatigue following activity. So someone has to have 4 or more of those for it to kind of count towards diagnosis.
And what's interesting is vagus nerve.
Yeah.
So like your vagus nerve is kind of around your throat region, and that kind of activates your has a role in sympathetic nervous system, which is your fight or flight. And a sore throat can be a sign of kind of like vagus nerve dysregulation or loss of tone because of excessive fight or flight, which is kind of like chronic fatigue.
Exactly. Your whole system is so tired. Poor thing. Like, of course it can't deal with going for a walk. It's already managing enough just from like a body system point of view
to just survive.
Exactly. So it can last from months to years. Most people feel better with what we're going to talk about, the changes you can make. Only a few people tend to feel worse, and your prognosis is better if you're young. So if you're younger and you kind of stumble into this, you've got a better ability to kind of pull out of it. Probably stereotype of being more resilient potentially. But so lifestyle changes are one of the best treatments. So nothing pharmaceutical comes close to exercise and lifestyle modifications for treating chronic fatigue syndrome, and I believe fibromyalgia. You get, obviously, but that's a whole thing as well. You could get a lot of pain medications prescribed, but whether that's best practice is different conversation. That's a messy one, so we're going to leave that I think for today, because I'm not telling you to not take it if you've been prescribed it, but
it's symptom management, but in terms of long-term management,
absolutely,
chronic conditions should be managed with chronic long-term changes,
absolutely, something that's maintainable and sustainable. Absolutely, I agree. So exercise is one of the few known therapies to actually help. That and cognitive behavioral therapy are the two that are like, do this if you have chronic fatigue syndrome, and you can get really good results.
So in terms of CBT, it would be changing, I guess, the thoughts that would drive maladaptive behaviours?
Yes, but I think even the thought of, if I go for a walk I'll be exhausted for 3 days, that would be something to challenge and change as well.
Yes.
Because that will then drive behaviour if that's the thought you're having.
The psychology of behavioural change.
Absolutely. Correct. I went through cognitive behavioural therapy and it worked absolute wonders for me. I'm a massive advocate for it. So don't knock it, anyone, if it's been mentioned as a potential therapy for you. It is brilliant. It targets, the thoughts you have that then influence your behaviours that then follow through to action and everything. It's
sometimes
really, really
those things sound a bit silly, don't they? They're like, you just see a diagram of some psychology unit and you're like, what did that do? But it's proven. It's a cycle. Brilliant. It goes back to the source of the thoughts.
Absolutely. It's like it deals with the cause, which is what we're all about.
Yes.
Absolutely brilliant. Anyway. So graded exercise therapy is what we're looking at for this, which is pretty much what it sounds like. Find something that's manageable. It could be like 3 minutes of walking, and you build up from there. So we're still talking like way below guidelines as far as half an hour a day would be way too much for someone with this diagnosis. So you find the threshold that they can maintain without crashing, without having a major response to it. And you build up like 20% every few weeks. Like it's really, really slow. Yeah. But really good for you.
Yeah.
So yeah, I just kind of wanted to touch on that. So even with something that is like a medical condition, exercise is still one of the number one go-tos for management.
Yeah, because it's like kind of that fine line of kind of, it sounds weird, but nurturing the diagnoses almost. Like this is what I have. I need to protect myself. But the more you kind of put the bubble wrap, the more it will kind of potentiate that feeling.
Absolutely.
And
become an identity.
Yeah.
Which is not good.
Yeah. And then the CBT obviously in gradual increments kind of like pops the little bubbles in the bubble wrap slowly.
Yeah. And it makes your world bigger because I find people, especially like chronic pain and things like this, their world becomes so small. All they have is their diagnosis and their symptoms. So you have to reintroduce things and make their life bigger than the thing that they're dealing with.
Yes. So it's not the thing that it doesn't penetrate every aspect of their life.
Absolutely. Which if you ever talk to someone, it's all that kind of matters. Everything is in relation to symptoms and just response into what you can't do. It is overwhelming.
Yeah.
So really nice to then open up small little bites, chunks, the things you can do, and then like accepting that you can do those because that can be really hard too.
Yes.
So absolutely, it's not easy, but it's worth it.
Completely.
With help, I would absolutely get help with this one.
I was going to say that too.
Absolutely. You've got enough that you're dealing with. At least get someone else to bounce ideas off of.
Yeah, don't do it alone. No. Have guidance and the reassurance that what you're doing is okay because once again it comes back to living a certain way for so long.
Yeah.
And second guessing any little challenges that you put in your life could cause a whole nother issue.
Absolutely. And from like a healthy behaviours, accepting help is massive as far as building resilience as well.
Yeah.
We talked about that. One of the big traits of being resilient is knowing when to ask and how to accept help. So that would be massive as well. And then so this definitely has like physiological components. So compared with just sedentary people who aren't sick, just are inactive, patients with chronic fatigue syndrome were physically weaker, had reduced exercise capacity and a greater perceived effort for exercise. So the same level of work felt like way more effort in someone with chronic fatigue syndrome and just aerobically unfit. So then they compared chronic fatigue syndrome with depression and found kind of similar issues as far as CFS have higher oxygen uptake during exercise. So their body will be like working harder during exercise. They were weaker and again saying that greater perceived physical effort and incapacity. They had weaker quadriceps muscles. They usually have a higher body mass index, so potentially body weight has a play with this. So like there are actually like physiological changes
that occur.
Absolutely. And so from that standpoint, like exercise, absolutely. But then everything else we've talked about from more of a mental health component.
And that once again just reiterates get help from a professional because if you have the kind of steps that put you back, you might have an increased risk of injury, etc. So it's good to have that guidance and control around it.
Yeah, so that would look like a clinical exercise physiologist for the exercise and kind of lifestyle changes.
I know one of those.
Do you? Oh, I reckon she's pretty good.
Yeah, she's not bad, you know.
Or a clinical psychologist for CBT. Yeah. So ask your GP and they should be able to link you up with both of those, I believe.
Yep.
You can even get them, if you're in Australia, get them covered under Medicare a couple of sessions. So that's pretty good. But I think that's mostly what I have to say about today.
Yeah.
Exercise. So good for you. Start
I really
slow,
liked this chat.
build it up. Yeah.
Very holistic. It was like well-rounded mental health, exercise, a little bit of nutrition.
It's everything I'm interested in. I even because I'd like to do a little bit more training in mental health and I looked up all the different courses you can do on counselling and mental health and CBT and I'd love to be able to do something like that.
Yeah, me too. Me too.
Amazing. I'll find a course
the
we can both do
brain can be our best friend or our worst enemy. Hey?
Brilliant, yes. And not for us to talk about today because it's not really, it's too big. But I also wanted to just highlight that in cancer treatment as well, exercise is amazing at combating the fatigue that you might get from treatments for cancer. So breast cancer has been crazy researched, and prostate cancer both have lots and lots of research around them. So just something to kind of keep in your noggin. Make sure if you know anyone going through that they are exercising, again, with supervision,
guidance,
because there is things to consider. But even in someone who has and is battling cancer, exercise is almost top of the list. And it can even reduce your risk of getting cancer again. Even getting cancer in the first place, but then getting it again.
Wow. So it's amazing episode of that, maybe.
Yeah, all right, cool, brilliant. I would have a guest on. I know exactly who I would invite. Cool.
Yes.
Cool, brilliant. All right, coming up.
Done.
Amazing. Thanks for listening to us this week. Hope it was okay. If you feel tired, exercise.
Thank you and good night.